Welcome to the Mr. Beacon podcast. Back to healthcare. It's a key industry and an application, something that we all find ourselves dealing with. And I'm talking this week to two gentlemen from Navenio, which is a really interesting company, infrastructure-free navigation, location of people, patients, staff, and things, assets in the healthcare environment. So Bill Close, COO, and Sven Albrecht, who heads up engineering at Navenio, give us the lowdown on what their solution does. We get into the business side as well as a bit on the technology side, how they're seeing these the kinds of solutions that they offer, helping to improve things, the key pain points, the way the technology works, and the use cases. And since they operate both in the US and the UK, we get into that. So some great technology that came out of Oxford University, but is really being applied in, I think, a mature way that we can all learn from. And do stay and listen to our discussion with them about their careers, some interesting information about McKesson, who are really key in the healthcare industry, major distributor of medical products, and also Palantir as well. So hope you enjoy it. I certainly did. Let me know what you think. Here they are. Bill, Sven, thanks so much for joining me on the Mr. Beacon podcast. We're back in the land of healthcare, which, for me is really ripe territory for IoT and indoor location and asset tracking and all that sort of stuff. And so I'm looking forward to learning more about the industry, learning more about your company, and what the problems are that you're focused on solving. So, Bill, maybe you should kick it off and just give us like the elevator pitch on Navenio and what you do.
So maybe I'll start with our origin, which we were born out of research at Oxford and research around indoor locationing, and they researched a number of different technology approaches, but in essence landed on harnessing the very sophisticated sensors that now exist on today's mobile devices or smart devices. And so what we have been able to do is really introduce this step change innovation, because if you're familiar with the market of real-time location services, or RTLS, it has historically been, it's been around a long time, but there are barriers to what I'll generally describe as an enterprise deployment of the technology, because it's such a heavy burden of cost and resource to get a solution like that implemented, whether you're in the UK or the US or anywhere else. You're talking about hardware, pulling wires throughout a facility, and it just becomes a long, heavy investment. If you think about the simple use of smart devices connected to the internet and cloud-based processing of the data collection from those, it really shortens, it reduces the acquisition cost and shortens the time to value significantly for being able to apply the technology. And it enables really, based upon the selection and maybe pursuit of an individual use case, you end up lighting up the entire organization for a utilization of that technology in a number of other areas that just become a natural offspring of the platform itself. So the reason why you might initially think of, wow, that innovation in indoor location, you could use in a lot of different market segments. The reason healthcare is so attractive is it represents the largest indoor workforce in the world, and through the digitization of healthcare, mobile strategies within health systems is now becoming very prominent. So you have the mobile strategies where mobile devices that are managed and owned by the health system are being deployed to resources in a shared mobile device strategy. So think of a nurse coming in for a shift, going to a bank of phones, picking that phone line, logging in, using it for an 8 or 12-hour shift, and then putting it back for the next person to pick up and use. And so that's how, and there's just a number of very well-known use cases. And we'll talk probably a bit more about what we've put on top of the core location engine in terms of some additional unique capabilities.
But this is fascinating. Infrastructure is the enemy in terms of deployment, especially healthcare. You don't want to be punching holes in walls, have dust going everywhere. And it's expensive and probably doubly expensive in an environment where the standards are even higher. So it makes a ton of sense to use the phone. I had heard in the retail space, obviously, there's a lot of mobile devices, companies like Zebra that make these specialized devices. But it sounds like you're targeting, regular smartphones. Is that the case, or have I got the wrong end of the stick?
So it would be really any iOS or any Android-based device. And so
Okay.
You mentioned Zebra, who they build a lot of purpose-built devices, but in this case, phones that we work with them in the healthcare arena, along with other devices like SpectraLink that are again purpose-built for healthcare. But again, so that would be in addition to your standard iPhone or Google phone that you'd have in place.
And what I'd heard in the retail space, which is another vertical we focus on quite a lot in this podcast, is that bring your own device is becoming, a major thing, which kind of surprised me because it sounds like it would be a bit chaotic. I imagine there might be some issues with that in the healthcare space. So is it normally the devices are provided by the hospital or the clinic?
Yeah, and that's what makes the market very specific because they're able to control the configuration, so the settings on the device to optimize for our technology. And so many times, along with their mobile strategy, they will have a mobile device management solution that sets standards for security and other configuration elements of the device itself. Versus having the variability that you just spoke to with a DIY type approach. But on the DIY side of things, there's no barrier for us to use those devices. And the best example of that would be wayfinding. Health systems and those campuses tend to be very complex to navigate. And so, and more as your personal health record becomes extended and available on mobile devices, they can opt, so let's say they download that app from the health system, they can opt in to that with that app to allow them to do wayfinding and be tracked and provide precise directioning or navigation information to that DIY device.
Yeah, I've been going to clinics more and more as I've been getting older and older. I just had cataract surgery, so I'm actually just off to the clinic after this discussion that we're having. I really like the fact I can do auto check-in now. That seems to get you through to the help you need faster, less bureaucracy, and presumably cuts costs. How give us a sense of the rate of adoption of this self-check-in navigation. Is it the exception or the rule now?
Well, I think I think it depends upon what market. I would say in the U.S. It's it's quite prevalent and being adopted quickly. And then, into a similar degree, but lesser so in the UK. That's more a matter of timing than it is anything else.
Yeah.
The challenge there is it still becomes fragmented, right? So there is connectivity and interoperability issues between systems inside of healthcare, and so what you have is just you might have four different applications or portals that you'd have to use in healthcare. So it's adoption, but it's not a ubiquitous solution for patient access in and across individual health systems.
Okay. So I want to come back to, well, all sorts of questions. One is more about the differences between the UK and the US. As someone who's kind of going backwards and forwards, I'm interested in that. And I want to focus in on the business problems that you're solving. But Sven, let's go over to you now. Can you talk a bit more about what's different about this technology? What's the state of the art? What is it that you're able to do, and how do you do it? And then we'll get to, well, what does that actually enable? Because people have been using phones to navigate around shopping malls for a while. It's been pretty iffy very often. What's your secret sauce?
Yeah, so happy to help here. So this is obviously the like an experience that I've had as well, where I was at an airport or in a shopping mall, tried to locate myself, and I got something that confused me a little bit. And if you get something that confuses you a little bit, you stop trusting it, and then it's actually almost counterproductive because you never really know. You have got this level of paranoia whether you actually are in the space that in the spot that the system serves to you. So from the way that I would describe the technology and like why it, I believe it has a very interesting and bright future, is that smartphones are obviously supercomputers in our pockets, right? And not only are they supercomputers in our pockets, they're also super sensors in our pockets. And the degree to which they compute and the degree to which they sense will only get better as time goes by, right? Like, so our ability to do smartphone-based, inside-out analysis of the environment will just increase. And at the same time, we know that, as you mentioned earlier, in a situation where you have an infrastructure-free solution or infrastructure-light solution, like these solutions, because they're more scalable, if they offer comparable performance in a real-life setting, they will end up winning. Right? This is why most people use Wi-Fi. They don't use LAN cables anymore. Most laptops don't even have LAN cables anymore. And devices like these VR goggles that exist now, they do inside-out tracking of the environment. They're no longer transmitters that they need in order to locate themselves. And so what we're focusing on from a technology perspective is to send the ambient, I would call it the ambient signal that's in the room. And that could be, for instance, Wi-Fi. So it could be the existing Wi-Fi environment, relative strength of different Wi-Fi access points that we can map and analyze, and then use in order to fingerprint an individual point in space. It could be things like Bluetooth and Bluetooth emitters. It could be things like magnetic information, because smartphones have magnetic sensors, which they is a data stream that we can also access. It could be things like air pressure. It could be things like accelerometer data. And so where we believe we have a state of the art and really like industry leading advantage is infusing these different data streams and using them to really identify the actual point that the smartphone is in. And generally speaking, and this is what I also learned in my past experiences, if you want to go where or if you want to see this kind of these industry leading capabilities, very often they are developed at the university and then spun out. like
Mm-hmm.
Navenio. And I would say right now, what we can get down to is in terms of location precision, couple meters. Like, and that's really pushing it. Like, it's kind of pushing I would say the physical limit of, what's possible if you only look at like, like these Wi-Fi and, and other like ambient data streams.
Mm-hmm. So, because one of the challenges with healthcare is, I can be sitting in a very small room, and it's important that for some use cases to know whether I'm in room 1 or room 2, because room 1 could have a cancer patient and room 2 could have someone with an ingrowing toenail. So, what are the use cases that are the sweet spot given the level of precision that you have in this infrastructure-free mode that you prefer to operate in?
Yeah, I think it might be before we talk about use cases. It might be to our advantage to talk about what we've built on top of the indoor locationing platform itself. And as I talk to folks in the market, the great news is the exact solution and the technology we're employing is very similar to things that people are using every day in their real lives with their smartphones. And so, in addition to our ability to localize a smartphone device, if you think about asset tracking, you're not going to put a smart device on every infusion pump.
Mm-hmm.
So in that case, what you would do is you would put a BLE tag on that particular device. And much like AirTags and iPhone, if you're familiar with that technology, not only is my phone detecting the location of my AirTag, but when I leave, let's say I go to the airport and I have a set of keys that I leave my home keys in the car and I leave. Well, I can still be rest assured that those phone keys or that those keys are there, because anyone that walks by my vehicle that is connected to the Find My network will detect the existence of my AirTag on my keys in my vehicle and report that up to the cloud and back to me.
Mm-hmm.
And so in a very similar way, that is how we are able to do indoor locationing for both people that are carrying phones, so that may be staff or patients, as well as medical devices like infusion pumps or other assets. So that's the broader strategy of the location platform. On top of that, what we've built, and the analogy here would be an Uber app. And so, much like Uber uses algorithms to incorporate the location, so there's a task requester or a ride requester, and then there are drivers. And what it uses based on a task request or a ride request is it says, okay, let me first identify as the crow flies the closest driver. But then it would incorporate, well, that driver is currently on a task and it's going to take them further away. There's another driver that's on task, and by the time they're done 2 minutes from now, they will be closer. But their route is actually encumbered by a bunch of one-ways or construction, and we need to then go to the third option because they will be there in 3 minutes versus the other two that were originally closer.
Mm-hmm.
And so we have built that set of logic in advanced algorithms and learning inside of the solution to do the same within healthcare, which is to optimize resource assignment to jobs to be done, like transport, like cleans, like catering, food delivery, rapid food delivery for patients inside of the hospital. So it was just kind of want to throw those two out there, because as we talk about use cases, it'll be relevant that the Uber concept is a known quantity as we think about that. That makes sense?
Yeah, it's great. People can totally relate, I think, to the AirTag and to the Uber, and it's great to see these being applied to this situation. When I went in for my cataract surgery, they didn't have a wheelchair to take me into the surgery. So I ended up walking, which was kind of a bizarre experience. You walk into this surgery, everyone's cloaked up, no wheelchair, and that was fine with me, but maybe other people would not have been up for it. So tracking wheelchairs, just one of the very basic things, I guess. How do you provide the tags, the Bluetooth tags to do that kind of use case, or you work with third parties?
We're agnostic to the device. There's communication protocols for these that we in essence provide a list of devices that we've, I'll say, certified or tested, and we've yet to come across one that has the standards met that we can't work with. But we leave it free to the customer to select what vendor or manufacturer they want to go with.
And Sven, what are you seeing technology-wise? What are the technologies that are winning the Bluetooth tag battle? What do you see most? Is it iBeacon-based, proprietary-based, Google Eddystone? What's the technology?
Yeah, I'm not sure. I'm not sure at this point. I would say there's a clear winner yet. Currently, I think it'll probably be decided within the next couple of years as some of these technologies take a foothold in the market, and then I think most companies in this space will consolidate around one of them.
But you have a certification process that you go through, and basically a list of the devices that are.
Yes, we will be testing extensively to make sure they are compatible with our platform, and we'll provide that list.
So it seems like this scheduling of workforce, whether it's porters or whatever, is one of the key things that you offer. What are the biggest drivers of adoption of your technology in the US versus the UK? Is there a pattern there, or? Well,
actually, and I had exposure to UK healthcare prior to joining Navenio as part of the consulting we provided on EHR implementation adoption.
And that's electronic health records, just to...
Yes, or EPR be the more common terminology in the UK. The reality is there are far more similarities than there are differences, even though there's a totally different healthcare coverage model in back and forth. But so the three main areas that we're targeting and that are common across would be patient flow, addressing ways to deal with the nursing workforce shortages, and the third is really around cost and how do you remove cost from the healthcare system, and again, cost is part A. The other, I'll just probably put them both under utilization. Mm-hmm. So whether you're doing asset tracking and asset management to better understand the number of devices you actually need by having better utilizations of the ones you have versus procuring new ones and you're at 50% utilization, that's a major cost driver in reducing expense out of a health system. The other would be in the U.S. revenue, in the UK more NHS payments, which is all about utilization of things like MRI equipment. So your number of scans and procedures that you're able to drive based on better utilization that's driven by more timely and predictable delivery of patients to those individual imaging devices is where you. So those would be the three areas that we're attacking with the technology today. And so we have a new government in power in the UK. Keir Starmer's in charge. If you add 15 minutes with him, what would you be trying to get him to do to increase the adoption of the kinds of technologies that you offer
into the National Health Service, which seems to have its fair share of problems at the moment.
Certainly, as a newly minted British citizen, I'm happy to give my opinion
All
on this
right,
one.
congratulations.
Yeah, thank you. It was it was last week actually. Let me see. I think that the staffing shortages within healthcare, especially within the UK, they're not going to improve in the short term, right? Especially also with demographic change, in the UK as well as elsewhere, it's only going to be increasingly important to actually increase the efficiency, of the existing staffing as well as internal processes. And I think that a tool like the one that we provide can not only make sure that the right person at the right time gets the right task, but also there is an additional level of auditability and analytics, etc., that can be layered on top of that. For instance, knowing where people are, what people are spending their time on, which parts of the hospital are, for instance, overutilized. And I think that there might be, and this is what I would tell them, there might be areas of improvement that can be identified as a result of this that were totally not obvious in the beginning. And so basically by deploying these kinds of technologies, it's not only that you're solving a very particular spot issue, but it's, I would say, one step in a series of a lot of steps as part of digitizing a healthcare system, and even allowing decision makers to evaluate what the right decisions are. And I would say that is the broader advice I could give them.
Okay, so we talked about the pitch to the Prime Minister. Who is the person that can actually help you the most to make a sale in when you're selling what you sell? Who is your target buyer? And does it differ between the US and the UK? Who is it that you're trying to get in front of that can actually make a difference?
Generally, our key stakeholders are going to be, and the terminology may be a little bit different between markets, but in essence, your chief nursing officer, your chief information officer, and then clearly your administrators over the operational aspects of an organization. So those are the call points that would be most relevant for us in terms of making decisions, and then sort of being champions for the actual deployment and adoption of the solution.
And how do they work together? Is there a driver to? I mean, everyone wants to save money. Everyone wants to be more efficient and presumably deliver better service. Are there some key drivers that you can use? In some areas there's a regulatory change. But what's happening that you're kind of trying to key off to get people to go from the old way to the new way, which is often, the big challenge when you've got a technology solution?
It's a great question. I think what the tailwind that we have is the areas we're addressing around patient flow and nursing. We don't have to convince anyone that that's a problem that is worth addressing. And so the reality is that it's bringing together. There are different lenses in which a CNO would look at that problem versus a chief operating officer or head of operations for a facility. The key is to bring them together and say, let's look at something like asset tracking and asset management. And you say to yourself, okay, where, through the lens in which you view this problem, where would we create the value and wins for the different functional areas of the hospital? Okay, from a chief nursing perspective, 20% of any given nurse's time is spent looking for medical equipment that they need to provide care to an organization. So by providing location awareness to those caregivers, we remove waste from their time and return that time to the bedside. That's important from a patient sat perspective, from a patient throughput perspective, and certainly from an overall care quality delivery perspective. The same solution that met that need for nursing would also be driving down expense. So you've got an ability to manage or understand where devices exist, what their utilization patterns are, that basically informs the level of procurement that you would need to do, or the physical placement of those assets for optimal utilization within a health system. Yeah. And so it's sort of bringing together different representations of need in the problem and solving for them very specifically, but using the same solution.
And are you creating this process from scratch by, you find someone who's receptive, you make the pitch, and then are you bringing people together? Or is there a wave of digitization strategies where there's a RFI going out for this sort of thing and you respond? What's the what's happening from a buying perspective as far as that's concerned?
Another great question, and I would generally describe the market for us as being demand generation versus us responding to a number of open bids that are out there that we're chasing. So it would be an entry point where we would illuminate the problem statement. We don't have to, again, advise them that there's an issue with patient flow or nursing, but right. What we would do is illuminate the opportunity to address that with a novel technology like indoor locationing to take a big chunk out of that problem with that type of technology at a very low acquisition point from a cost perspective.
I mean, I remember when I started my technology career, it was the move, I'm really dating myself here, to accounting systems. Previously it was like manual, it was mainframes. And then suddenly every CFO that was worth their salt knew that they had to choose Oracle Financials or something like it. And then boom, there was just this massive pile on of systems integrators, hardware suppliers, software suppliers. And it seems like we haven't quite got to that point in your space yet. It's not like every chief nursing officer is like, well, where's the system? You've got, how do we get there?
Yeah, I think, I'll give first experience in the U.S., which I think correlates, again, maybe just a few years behind from a U.K. perspective. Yeah. Part of the challenge is the implementation of things like an EPR. Ultimately, they're there to provide higher quality care and documentation of care for patient safety, quality of outcomes, and other things. Mm-hmm. When that hits the daily work function of, for example, a nurse, it does provide additional intelligence, but at the end of the day, it actually provides an additional set of work in terms of their need to interact with the system for the purposes of documentation, med administration, and a number of other things. So I think that technologies like we are bringing to the market, I sort of use this phrase that we're in a position to provide a significant impact to nursing without impacting nursing, meaning it's all upside to them. We're able to provide value by way of telling them or informing them where a piece of medical equipment is to do their job, or automating the assignment of, again, a transport task to the right resource and provide that nurse with an estimated time of arrival for when that individual performing the work will arrive, doing two things. One, her ability to inform the patient and set an expectation there. And number two, the other major time what steals time from a nurse is in the absence of knowing when someone is coming to complete something, I'm going to decide to do it myself. And
Yes.
so studies will tell you that, 15% of a nurse's time are on tasks that are otherwise delegatable to a lower license or a lower level of skill requirement. And so that is just another give back to patient care and bedside time.
Bill, can you tell us a bit about how you ended up in your current position? It looks like you had of the order of 14 years in McKesson. That sounds like probably hugely influential, I imagine. How has that helped you in your current role?
Yeah, so I was actually at McKesson for close to 20 years. I started as a college hire, and I was in the field implementing supply chain technology in healthcare. And so I spent over the course of those 19 years, evolving into a number of different roles. And for about the last 10 years, was a general manager for a number of their different business units, anywhere from automating healthcare information management, sort of digitizing paper medical records for automated distribution and workflow inside of healthcare, to a large-scale managed services. So as we did remote hosting of our technologies in the healthcare market, providing a managed services and set of support staff around our platforms.
And for people that aren't familiar with McKesson, what's the elevator pitch on them? They're a very large player, but what do they do?
Yeah, so McKesson is probably the largest pharmaceutical distributor, certainly in the U.S. And they acquired they expanded their portfolio into the technology arena, and they acquired HBOC. That at the time, HBO and Company was the leading patient administration, patient billing solution in the market. They had acquired several different existing vendors and consolidated those onto a number of different platforms. And from there, they expanded from revenue cycle into both the clinical documentation space as well as the ambulatory space. So McKesson grew that business, and ultimately they have since divested those technology assets back to focus on their core business, which is distribution and pharmacy automation.
All right. And so it must have been a huge change to go from the biggest player in the market to some of these smaller organizations that you moved on to.
Yeah, so my next journey was to a very technical, oriented organization in Nuance, and they provided voice recognition, natural language processing. They were a company that half of their revenue came from non-healthcare, which would be automotive, electronics, mobile devices. Think about most of the speech rec that was done in automotive, in the automotive space, had a core of their technology. They used that same technology in the healthcare arena to do, in essence, front and back end speech recognition for the purposes of clinical documentation. And so if you think about, for years, clinical documentation and transcription would be done by a physician walking out of an encounter with a patient. They would speak into a phone and describe the patient, the appointment, any diagnoses or other documentable clinical elements. And that would be at some later time listened to by a transcriptionist and typed out into a documented medical record for the encounter. In essence, they took the technology and put it in the middle of that process in which the speech detection would translate the dictation into a draft document, and the transcriptionist would simply do a review mode and then approve that document or feed it back to the physician for any deficiencies, meaning there were gaps in the documents or unclear elements of that. So it was a complete workflow solution that accelerated the turnaround time of clinical documentation as well as took out a ton of the labor cost.
Right. And I kind of misspoke. So you kind of went from a giant, maybe you went to another giant, maybe not quite as big as the previous giant, but very dominant in your space, I guess.
Yes.
Fair enough. And has that changed at all? Obviously, there's been a lot of stuff going on in AI and so forth. Is Nuance still doing well?
Yeah. The evolution of that is really in two areas. One would be ambient speech, where they're able to detect voice signatures and differentiate a patient voice from a doctor voice and do real-time documentation of an entire discussion. And then the other area would be in the area of virtual assistants. And so an ability for a physician to interact with their technology voice to voice with intelligence and AI that would direct that conversation to clinical protocols, for example, as a best recommendation for a care path and those types of things.
It sounds like an interesting area. So what tempted you onto new pastures?
Well, I got an opportunity for running a large-scale consultancy. We probably had about 2,000 consultants, and in essence, what we were doing is implementing and optimizing the electronic healthcare record. There was a government mandate for the meaningful adoption of electronic health records in the U.S. Everyone had to buy and implement. They did it quickly. There were changing requirements over time, and we provided resources to help hospitals both implement as well as then enhance and optimize their solutions. So it was a good opportunity to run a very large-scale business as their president, and that was just not so much running from anything, but running to a major new opportunity in that role.
Very cool. And then after that?
Well, and then I dabbled in a couple of startup arenas inside of healthcare. But most importantly, was contacted by our CEO, Connie Mosier, who was a veteran of McKesson as well during the same time that I was there, and told me a bit about Navenio and the step change technology that it represented in a space that, quite frankly, she and I were familiar with from early in our career within supply chain and RFID. And, basically told the story to me about where we stood as a business inside of the UK with our success there, and a launch plan to both, expand certainly our market share in the UK with the NHS and within private institutions there. But, the U.S. represents a very large addressable market for this solution, and brought me on board to help scale the organization to drive our solution into the market.
Excellent. All right, Sven, what about you? How did you end up going from Copenhagen to London?
Yeah. So, originally I actually ended up in Copenhagen because I went from Germany to Copenhagen. So I did my, I'm German originally. Did my undergrad in Germany and then moved to Copenhagen for a master's in physics. So I was very interested in quantum physics, and Copenhagen is kind of a center for quantum physics. There's the Copenhagen interpretation of quantum physics, which is one of the major ones where people try to make sense of how the world really looks like based on what the theory predicts. and did my PhD there as well. The PhD was in essentially the quantum computing program of Microsoft. So it was a Microsoft-funded project where I was, on the one hand, really fabricating electronic nanochips. So really like small-scale, nano-sized transistors and electronic devices, and then measuring them as well. And the focus of it was really to create something that physicists at the time called exotic states of matter. And exotic states of matter are states of matter where things like electrons or like other particles behave in ways which is just completely unintuitive and just doesn't typically happen in nature unless you create very specific conditions where this can happen. And the interesting thing was that it turned out that these states of matter that we were fabricating and measuring, they were actually useful. So they were predicted to be useful as building blocks of a quantum computer. And so, yeah, I basically always say I've done the kind of very top of the technology stack, and by that I mean, like a high-level programming language, programming, but then also the very low level. And the very low level is me sitting in a fabrication room next to an evaporator. So this is like a big machine that's entirely evacuated with like a small chip inside, and then evaporating single atomic layers of aluminum onto that chip, and asking myself, do I want to have 50 atomic layers or like 150 atomic layers, and how thick should they actually be so I make a transistor out of this? So it's like very, very elementary like hardware research.
Yeah, deep tech.
Yes.
So what got you to Palantir?
That's a good question. So I finished the PhD and it was interesting, and I think I got a lot out of it. Like, as in, it was like some of like the most like cutting edge stuff I've ever seen, and that was amazing. But at the same time, especially when it came to quantum computing, people always say, "Oh, it's like 5-10 years in the future." When the actual application come that are practical and really deliver value. And so, I was really much more interested in doing something where I can see the value right now of what I can deliver with it. And this is something that Bill mentioned earlier in the context of Navenio, which is this notion of a step change. So I wanted to see like technology really drive a step change that I could actually validate and test for, and then apply in some business context. And so Palantir was obviously very intriguing. It's was a very company that had I think it's a very, let's say, charismatic company that has like very high ambitions.
And can you give a quick kind of elevator pitch on Palantir? How would you explain what they do?
Yes, so US-based company, founded in Silicon Valley, focuses on both the defense space. So they have a like large, part of the company that's focused on defense. Think, processing of like signals intelligence and being able to supply and enrich like battlefield intelligence with information required to conduct missions. And on the other hand, being able to derive actionable insights, so results and insights that really lead to like a direct like action by like some operator from large scale data sets. And so what I was focused on was I was working in the commercial part of the company, and so we were looking into things like facility optimization systems, production optimization systems, where you can think you are about, for instance, having a football field-sized industrial plant with thousands of sensors that stream terabytes of data consistently.
Okay.
And then you want to use this data in order to actually make decisions about, for instance, do I open this valve? Do I close this valve? In order to drive some outcome like producing more, or for instance, reducing like some process and the lead time of some process.
Can you draw the dots between what you learned there and its application today? Is there any relevance? It sounds like there might be.
Absolutely, yes, like for sure. So like to me, what I'm really interested in is technology at the forefront of what's possible, basically just really something that's kind of fresh, cutting edge research, but then applying this. applying this to something. And so an example is in the Palantir context, just making data available to an operator, like for instance, being able to say a pressure in a certain like valve, like in an industrial plant, being able to monitor this from like tens of thousands of miles away and draw conclusions from it on, for instance, the shipment next week is going to be late. You might want to adjust our production plans and our production estimates. Like these kinds of information are, I think, quite similar to the information that a system like Navenio can provide in production. So the idea behind Navenio, obviously, is to be able to provide real-time location services in a healthcare environment,
right?
And just being able to do this with the required precision and in real time to the respective operators allows them to potentially task people, or alternatively know where assets are in a way that they just weren't able to do before, which opens up a complete set of new use cases and commercial opportunities that they didn't have before. And that's, I think, what I'm interested in professionally, really. And
then Tractable, what can have that was how big was that? It looks like they actually had some decent fundraising rounds, so it wasn't that small.
Correct. Yeah. So like I joined them. So maybe for everybody's context, so Tractable is an insurtech startup, scale up when I joined. And what Tractable is focusing on is essentially to speed up disaster recovery, and specifically from things like natural disasters or potentially collisions, car collisions. And I'm talking about fender benders, not necessarily like a really bad car accident or something like that. And so the idea behind it is that we are technologically at a point right now where computer vision is so good that when it's being fed enough data, it essentially makes visual decisions, visual assessments better than a human. And so in a situation where an insurance provider, so you have a car accident, let's say like not a very bad car accident, but a car accident nonetheless, and your car needs to be repaired. So your car will go into the repair shop. The repair shop will make an estimate, will send pictures to an insurance, and basically ask the insurance, hey, is this repair approved? Can we go ahead and repair it? And so that is a visual assessment. And it's a visual assessment that an insurance needs to make based on a pretty standard set of images. So, car collision damage looks pretty similar. And there are large scale data sets available that encapsulate the information of how expensive, how workload heavy a certain repair is. And so what Tractable did was, Tractable specialized in training machine learning models to make these assessments. And this has, similar to what I just mentioned about Navenio and some of the applications at Palantir, it has a disruptive effect that you just cannot, you cannot replicate just by doing this assessment using humans. So for an example is, your car typically, there are situations where the repair takes 12 hours, but like your car stands in a repair shop for 7. And so you have to, sorry, not for 7 hours, for 7 days, right? Like, so like a 12-hour repair, a 7-day, just like standing time. And that means you will have to get a rental car. You might lose certain appointments that you had, scheduled. It's costly to your insurance provider. It drives your insurance rates up. And so if you can make this assessment instantaneously, then all of that goes away, right? And you can potentially hand in your car, get it repaired, and then maybe drive it even back like the same day. Or alternatively, you can do repairs at the point of, or you can do assessments at the point of accident. If you have an accident, you take your phone, take a picture, send it in to someone, and they can immediately do this assessment. And so how this, I think, has similarities with what Navenio is doing is just this, the real-timeness, the real-time streaming and availability of information and associated processing that leads to some operational decision. So in the context of Navenio, a person is in a certain location and something happens, for instance, a task is required. To be able to then assign it to this person is something that is the ability of that is very related to the knowledge and the information that this person is there at the time. And that to me is really, this has been the red thread in my career, and like the things that I've always been interested in. It's like some kind of cutting edge technology, be it AI, be it real time location, and then applying this to something and really driving value with it.
Well, I'm resisting the temptation to dive even deeper into this, but because I won't. But I just had my car in the shop for a month over a dent that was this big, and it cost like $9,000, and I'm getting kind of flashbacks of this horrible experience, and I suspect Tesla weren't using the software that your company made, unfortunately. Anyway, well, very good. Let's move on to the toughest question of the interview, which is 3 songs that have meaning to you. Were you able to think of 3 songs that have meaning to you? Sven, maybe you can continue as you've got the mic.
Sure, yeah. I would start off with Instant Crush by Daft Punk.
Oh, excellent.
And yeah, there's a reason to it. So like at the time I was in Copenhagen. I was doing my PhD there, and it was the summer of 2013. And I still remember it. And basically, I've never liked the summer song. There's always a song in the summer that everybody's playing. I've never liked that one. And this year I did. And I remember sitting by the harbor and the people going by on the boats, and everybody was playing it. And I just heard the song that I like all summer. And that was great.
Excellent. So Happy Memories, a good song.
Yes, definitely.
And very astute stars. They got all the benefit of being megastars without the hassle of being unable to walk around the street and have a quiet meal in a restaurant. Okay, so that's number 1. And number 2?
So there is this is going to be an odd one. There is That's Mathematics by Tom Lehrer. So
by who?
There's a guy called Tom Lehrer. He was he made kind of funny songs. Actually, I think he started in like the 50s or so. He's now in his 90s. Lives in he's also a mathematician. Lives in Harvard, like in Boston, I believe. And so the song is That's Mathematics, and it's actually targeted at children. It teaches about it's mathematics when a ball bounces off of a wall. When you cook, it's mathematics. And the conclusion is basically try as you may, but you can't get away from mathematics. And that's quite central to what I believe, given that I'm a physicist and I kind of view the world in this way.
That's very cool. Very cool. We've never had that song. I've done 200 episodes, 8 years. This is a first. Okay, what's your third one?
The third one is I'm going with some classic, psychedelic rock here. That's Pigs by Pink Floyd.
Oh, all right.
So the 3 different ones. So the third track from the Animals album.
Yes.
I remember I was like 15 when I heard it the first time, and David Gilmour does this thing with a guitar that makes it sound like a pig is squealing, and at the same time it just grooves, and I just thought, what is this? And I've been a Pink Floyd fan ever since.
Have you caught the Saucer Full of Secrets tour that's going on? The sort of the folks from Spandau, this guy from Spandau Ballet, and
I would love to go.
Yeah, me too. Very good. Well, thanks, Sven. Bill, what are your 3 songs?
Well, mine are all probably soft and sentimental, but
nothing wrong with that.
First one would be "Cats in the Cradle" by Harry Chapin. Second would be sorry, you can't move on that quickly. You got to tell us why that song. A special meaning to my relationship with my father, and
great,
to a large degree with my own relationship with my own kids, and so it's it's just been an important influence, and kind of anytime I think about, anytime the song plays, I think about him.
Oh, that's very cool. Did he like the song, or
yes.
was this?
Yeah, he did as well.
Very good. Yeah, that was so. For sometimes people ask me about mine, and definitely mine's Dave Brubeck. Take 5 is one of them, and for the same reasons. So what's number 2?
I'll give you 2 and 3 at the same time, because they both kind of run parallel to why they're significant to me. The first one would be "I'll Stand By You" by the Pretenders. And the last is You Raise Me Up by Josh Groban.
Okay, very good. And what's the significance of those?
So this is another reason why I will never leave healthcare as long as I'm still employed, and probably even beyond, in terms of a focus on my wife. Spent about 7 years deep in healthcare with brain cancer.
Oh,
and she passed 10 years ago. And when you have a journey like that, with that acute of disease, you get to see the best and worst of what healthcare has to offer. And so that would be the reason why I'll never leave, because it's a target-rich environment for improvement.
yeah, lots of problems to be solved.
Yes, but the significance there is you go through a lot of up and downs in that setting, and those were two songs that we through. She was being treated out of a healthcare institution out of state. It's probably about a 6-hour drive away, and we had to make that commute about every 60 days for 7 years. And we always had a habit of playing those two songs because it was about supporting one another through that process. So,
yeah, well, they're great songs to listen to, and I think we all try and have, as we advance in years, or maybe even when we're not advanced in years, we try and do things to earn a living that have meaning to us. And it sounds like that you've done that. So, which is important. Any business has its ups and downs, and if you can have purpose, then it makes a huge difference. Well, this is very good. Unfortunately, we've got to wrap up. I had a bunch of stuff I wanted to ask you about AI and co-pilots for nurses and doctors, but maybe some other time. Bill, Sven, thanks for telling us a bit about what you guys are doing.
thank you.
Pleasure.
Thanks for watching this episode of the Mr. Beacon Ambient IoT podcast here on YouTube. You can listen to this episode on iTunes, Spotify, or wherever you get your podcasts. If you enjoyed it, please like and share this video. And be sure to subscribe for more videos. For more information about Wiliot, Ambient IoT, and IoT Pixels, head over to wiliot.com.